final thoughts. Yes, congratulations. You made it through the course. You learned a whole bunch of things. You learned ways to tape various parts of the body from head to toe. But there are just a few things that I really want to emphasize and leave you with before this class ends. The first is to remember your contraindications. So these are your red lights. This is when you do not apply tape. These can have very serious consequences if you don't pay attention. And although tape doesn't seem like a big deal, to some people, depending on how sick they are or what conditions they have, it can be a big deal. So periodically review your contraindications and also be confident enough to say no to taping, especially if you feel like it could further compromise their condition or it could be dangerous to that person. Remember that the whole reason you're taping is to provide a solution to someone, and if you're ignoring the contraindications, you're just perpetuating their current problem or complicating any current comorbidities they may have. So just remember to keep your contraindications at the forefront of your thought process when you're taping. The second thing I want to say is focus on the principles. So this is where, when I say it's not an exact science, comes into play. If you can learn the principles behind taping, that's how you can make it your own. If you can really understand facilitation, inhibition, circulation, edema, effusion, joint range of motion, all of these things about the body, and then you understand tape itself, you can start to formulate ways that work for you, and then you try it out, and then you see how people respond to it. Hey, the way you taped me last time was really great, or the way you taped me 2 times ago was great, the last time wasn't so great. You can play around, see what works for most people, see what works for each individual patient or client, and just kind of add your own flair to all of these things. Now, that doesn't mean just totally tape somebody up like a mummy, but it does mean that you have a little bit of leeway. You can get a little creative. You can modify accordingly, and by modification, maybe somebody needs additional tape here, or they need more stretch, or this person needs less stretch, or this person needs 2 types of tape, or you can play with the I and the Y, and then multiple cuts in one piece of eye tape, that sort of thing. But this course was a good foundation for you to start building all of that upon. Third thing is clean, dry skin. We really didn't show any of that in this taping, but it should be assumed that you are taping on clean, dry skin. I use a skin cleaner specially made for pre-taping. However, you can make your own if you just do some rubbing alcohol and water mixed together. And the ratio for that can vary because it depends on what rubbing alcohol strength you use. But try a 50-50 to begin with. See if that works. You don't want something that's going to completely irritate the skin or dry it out too much, but you want it to be clean or cleansing enough that it can take some of those natural oils off, and especially if they have lotion or anything topical applied to them, you want to be able to take that off. Otherwise, your tape will not adhere as well, and if it doesn't have good adherence to the skin, it's not going to be able to lift it and do all of those things that we want it to do. Trial and error. This kind of goes back to the principles part. You can try things, determine what works for you as a taper, determine what works for your patients or clients. And remember, the first time I tape every patient of mine who's never been taped before, it's a little experiment on its own. Let's see how you respond. Let's see if it helps your symptoms. Let's see if it irritates your skin. I don't necessarily tell them all these things at first, but the next time I see them, I'm going to ask them the questions. Oh, so how was your tape? Did you like it? Leave it kind of open-ended. So that's not open-ended, but Allow them to elaborate is what I should say. Oh, well, what did you like about it? Or what did you not like about it? And then you can either choose to tape again with modifications, or you can discontinue the tape. If somebody comes up to you and is like, I hated it, I didn't like it at all, don't waste your time trying to convince them to do it again. Just move on. Move on to something else. There's lots of other things that you can do to help people. The last thing is try various brands. So you saw firsthand on that figure 8 ankle taping that was not the best brand for that. It was not sticky enough, and it didn't respond well to heavy stretch. That said, I usually have various brands that I go to for different things. Some of the brands stick a little bit more, some of the brands stick less, some of them have better, how do I want to say this, better weaving and mirror the skin and fascia a little bit better. So you have to think, who are you taping? What do you want? Do you need a wide variety of tape? Or if you're taping the same person or same type of person over and over, you may not need to invest in all of that stuff. The other thing that they do offer is a spray that you spray on before you tape to actually make it stick more. That I would only recommend if you're taping swimmers or really, really advanced athletes that need strong grip. Other than that, most tapes work for the general population.